Hi, I'm Dr. Sowjanya, pediatric specialist at Akkineni Hospitals, Vijayawada. Hope you and your family are doing well. Let's go through some essential points today. Stay engaged and note them down.
Let's talk about something that is, without a doubt, one of the most terrifying things a parent can ever go through. Your child has a fever, which is stressful enough, and then all of a sudden, a seizure starts. Today, we're going to demystify febrile seizures. We're going to turn that fear into facts by breaking down exactly what they are, why they happen, and most importantly, what you need to do in that moment. It really is a moment no parent ever wants to even imagine. Your child has a fever, maybe it's just from a common cold, and then in a split second, everything changes. Their body starts to convulse. It is just such a sudden and frightening shift. And let's just be absolutely clear about this. That feeling of complete and utter terror is 100% valid. Seeing your own child in the middle of a seizure is a deeply scary experience. So our goal here is to acknowledge that fear and then, hopefully, replace it with some solid, reassuring facts. So, to start, let's really look at what makes this so incredibly frightening. What does a parent actually see when one of these episodes is happening? While the whole scene can be really dramatic, your child might suddenly lose consciousness. Maybe their eyes roll back in their head. Their whole body can go stiff as a board, or it can start shaking all over. You might even notice their breathing becomes strange or irregular. It's a really alarming set of symptoms that can make 1 or 2 minutes feel like an absolute eternity. So, okay, that's what it looks like from the outside, but what's really going on inside your child's body? Let's decode the science behind this, because this is where we really start to turn that fear into understanding. And that brings us to the single most important definition we're going to talk about. A febrile seizure is a convulsion that happens in a young child, we're typically talking between 6 months and 5 years old, that is caused specifically by a fever. And here it is, the most critical part. It is not epilepsy. This is a totally separate, distinct event that's triggered by the body's reaction to the fever itself. Now, these seizures are also broken down into two main types. The good news is that the vast majority are what's called simple febrile seizures. This just means the shaking affects the whole body, it lasts for less than 15 minutes, in fact, usually just a minute or two, and it only happens once in a 24-hour period. Complex seizures are much less common. They're the ones that might go on longer, happen more than once, or maybe only affect one part of the body. So, of course, this leads to the most natural question: why? Why on earth does this happen? I mean, fevers are so incredibly common in childhood. So what is it that triggers this really dramatic reaction in some kids, but not in others? It turns out it's not just one single thing, but it's more of a perfect storm of factors. A key trigger is often how fast a temperature spikes, not necessarily how high it gets. And this happens because a little kid's brain is still developing, right? It's just more sensitive to those quick changes. There's also a genetic link. If it runs in the family, the risk can be higher. And all of this is usually kicked off by a run-of-the-mill viral infection. And while I can feel like you're the only person in the world this has ever happened to, you are so far from alone. Somewhere between 2 and 5% of all children will have at least one febrile seizure. It's a known and actually pretty common pediatric event. This is also something that's really tied to a specific stage of development. You can see here, the risk is at its highest right between 12 and 18 months of age. Then, as the child's nervous system gets more mature, the chances of having one of these just steadily goes down. Okay, so we've covered the what and the why. Now we're getting to what I think is the most important part: what you should actually do if it happens. This is your in-the-moment action plan. But before we even dive into those steps, we have got to address the single biggest fear that flashes through every parent's mind in that moment. Does this hurt my child's brain? Okay, let me be as clear as I possibly can on this. The medical evidence is completely overwhelming. Simple febrile seizures do not cause brain damage. They don't affect a child's intelligence, they don't lower their IQ, and they don't cause any long-term behavioral or developmental issues. As terrifying as they look, they are, in the long run, benign events. So, with that huge weight off your mind, here's your 4-step plan. Step 1, gently move your child to a safe spot, like the floor, and turn them onto their side. Step 2, don't try to hold them down or stop their movements. Step 3, and this one is so important, never ever put anything in their mouth. And step 4, just glance at a clock and make a mental note of when the seizure starts and stops. Knowing how long it lasted is really helpful information for the doctors. That 4-step plan covers a typical, simple seizure, but there are definitely some red flags that mean you should call for immediate medical help. Call 911 if that seizure goes on for more than 5 minutes, if your child has trouble breathing or isn't waking up afterward, or if they have another seizure right after the first one. You should also always call if they're younger than 6 months old or if they're showing signs of a more serious infection like a really stiff neck. Okay, finally, let's just zoom out and look at the big picture. After the fever is gone, after that scary moment has passed, what is the long-term outlook for a child who's had a febrile seizure? Really, the key message, the main takeaway, is this. Despite their dramatic presentation, the long-term prognosis is generally excellent. That terrifying event is completely out of proportion to the actual long-term outcome, which is overwhelmingly positive. And what about that lingering fear of epilepsy? Well, having a simple febrile seizure does not mean your child is going to develop a seizure disorder. The risk is only about 2 to 4%, which is just a tiny bit higher than for any other kid. For the vast majority of children, this is just an isolated event that they simply grow out of. You came here looking for answers, and you were probably feeling pretty scared. But now you are armed with facts, with reassurance, and with a concrete plan. So the last question to think about is, how can you take this knowledge and become that source of calm confidence for another parent who might be going through that same terrifying moment? Thanks for joining me.